For many in the Northwest, health care is a luxury. In Oregon alone, 500,000 people have no health insurance at all. So last week, I looked in on a program aimed at helping those most in need. It began with a group that used to travel to Mexico to provide emergency clinics there. Then they turned around and saw the same needs right here at home. As volunteers set up early Saturday morning, the line begins to form. Terry Lawhead and her son are right up front a full hour before the clinic is scheduled to open.
She said if you want to get in, be there early. So it was worth it.
Yeah.
Get his teeth fixed.
Lawhead says she's unemployed. Her husband is retired on disability and they can't afford dental insurance. But her son needs at least 2 teeth pulled.
I don't know what, low income people are supposed to do, but you got to do what's necessary for your kids.
Relax your lip a little bit.
In a matter of hours, with donated equipment, 250 volunteers transform Woodmere Elementary into a dental office, a chiropractic clinic, a cardiology center, and it's all at no cost to the patients who show up.
Just be standing there and all of a sudden I'd feel tingling and I just black out.
In one of the makeshift exam rooms, Kim Murray, a diabetic, gets advice from Dr. Gary Pape. He is astonished to hear the spikes in her blood sugar levels.
When you go from 150 to 500, you're going to get blurry vision in general.
Murray tells us she's been having seizures but doesn't have any health insurance, can't get medicine, and can't get the tests she knows she needs.
But that's why I'm here. I'm trying to get information, trying to find out some resources, because I don't want to die.
Patient after patient, the people at this clinic called Compassion Southeast do their best to help. It all began 3 years ago when this man, Pastor Gary Tribbett, realized on a medical mission trip to Mexico there were people right in his own backyard.
Chronic headaches.
With the very same needs.
Stomach ailments is a big one.
Initially, he saw nothing but obstacles.
This is America, all the red tape and all that kind of stuff. That too many hoops to jump through. What about the liability? All these issues. When I went to bed that night, it just kind of haunted me. Here you're a pastor and very little faith.
So he called a doctor friend and some other pastors and put together a clinic the first year that served 300 people. It's only grown since. Often there are language barriers. On this morning, the clinic is short on interpreters who speak Chinese. So when asked, I do my best to help.
Wow, that's a lot.
Many of the patients are children, some with tooth infections they've dealt with silently in pain for months. This little girl can't eat without hurting.
We're going to take your tooth out. It's not in very good shape.
OHSU researcher Christine Bethal says Oregon is now in the bottom 9 states when it comes to children having health insurance.
When you look at Oregon, uninsured children are only about half of them or less than half of them receive the basic single, even one visit for preventive or dental care.
Up until what age?
That's all children.
By 10:30, an hour and a half into the clinic, the dental services are all booked up for the rest of the afternoon, and they have to turn people away. That's why Mary McGuire is so grateful she got in under the wire.
What does it mean to you that they even have this available?
It is just a heart-wrenching thing because, I'm homeless, and a lot of people just look down on us and treat us like not even human beings, and so that people out there, it's just really wonderful that they care.
Using compassion to care for the most basic of human needs. The clinic served 150 people with supplies donated by Providence and Portland Adventist Hospital, also with help from the Union Gospel Mission and Luis Palau's Season of Service. They are planning more of these in the future, so if you want more information on that, head to KATU.com, and we have this all in the hot links section for you.